Okay. Well, welcome everybody. My name is Steven Munatones, and I am the CEO and co-founder of KAATSU Global. And today we have two very special guests, two doctors of physical therapy who are very well acquainted with KAATSU. And that is Courtney, at least on my screen, to my left, and Patrick below. Um, Husband and wife team out of Connecticut, where they have two locations. Um, I don't want to steal your thunder, so maybe Courtney or Patrick, you want to explain, first of all, what you do, where you are, and then how do you incorporate KAATSU to your practice? And then we'll
Sure.
open it up to questions.
Yeah, my name's Courtney. I'm one of the owners of our practice, Regenerative Edge Physical Therapy, which is in both Madison and Hamden, Connecticut. I specialize in pelvic floor therapy, and we have a team of pelvic floor therapists who work with us as well. And I'll let Patrick speak too, but he does the orthopedic physical therapy side of things. So we have a really nice practice that sums up both pelvic floor and orthopedic care and really working with our patients in a kind of dedicated one-on-one setting so we can address all the different factors going on at one time for whatever, the different complaint or both, multiple complaints can be, and helping people towards their goals. So we use KAATSU with our patients for a variety of different issues. A lot of that tends to be for chronic pain. It can be for blood flow circulation before or after, surgical recoveries. It can be for upping and helping with muscular building and hypertrophy with our different rehab exercises that we're doing. And so there's a lot of different ways that it gets integrated with just the patients that we are working with. And I'll let Pat say a little bit more as well.
Yeah, perfect. Thanks, Court. So, like she said, we spend about an hour with each patient, so we have a plenty of time to um, dedicate to making sure someone understands the pros and cons of whatever intervention we're using. So, with specifically KAATSU, we use it. I use it with most of my patients, most of my sessions with them, um, and I'll basically just use it in addition to the things I was going to do already with my physical therapy and rehab activities. So I'll always start off like gentle, obviously, and then kind of work up from there. But that's basically the general gist of it. We'll see you. Happy to answer any questions you guys have.
Yeah. Well, I just have, I'm not a physical therapist. And so what I'd like to learn from you is, so these patients probably come to see you for the first time, maybe after an injury. They've never heard of BFR. They've never heard of KAATSU. And then all of a sudden they see this product that looks like a tourniquet, doesn't function as a tourniquet. How do you go about just explaining to your patients? And then if they have a little hesitancy, how do you explain KAATSU so they can overcome their hesitancy, and then you can start working on them?
If someone is ahead of the appointment asking questions about it, I can send them like a YouTube video that'll basically like a KAATSU demonstration of someone using it. If it's in session, that'll take probably 5 minutes to explain how it works. Try to make it sound because the term blood flow restriction sounds scary to the average person when they hear it.
Yeah.
Obviously, why would you want to restrict blood flow anywhere? But when you understand like the application of it and why you're doing it to make the exercise more challenging or whatever you're doing, make it a more challenging version of whatever you're going to do. They usually come around. I've only had maybe a handful of patients who flat out refused it, and even the ones that refused it initially usually come around after a couple sessions of doing exercise with me eventually.
Yeah. Got it. Got it. And Courtney, you mentioned when you were introducing your practice about pelvic floor um, exercises or therapy. Can you, first of all, explain what it is and then how you apply it to your patients?
With pelvic floor therapy,
Yes,
just
yes.
in
Just
general. Yeah.
separate, completely separate from KAATSU.
Yeah. Okay. Yeah. So Essentially, what we're working on in pelvic floor therapy is any issue regarding bladder health, bowel health, sexual health, or pain that is more so focused in the pelvic region, and sometimes including the low back or hips. And so, that can also include genital pain and that sort of situation. So, it really is working with, a little bit more of an intimate part of the body, but a lot of these symptoms, let's say bladder leakage, for example, or pain with intercourse, or constipation, things like that, or pelvic organ prolapse, feeling like a heaviness or pressure in the pelvis. A lot of these issues come about from musculoskeletal, or kind of how our muscles and our bony alignment and the daily habits and activities that we have, a lot of it can put more stress essentially on the pelvic floor. And so in pelvic floor therapy, we are working with someone's whole body to address where the stress is on their pelvic floor and how we can change that. And to essentially break it down even further, sometimes that means people need a little bit more relaxation, if you will, around their pelvic floor, and to reduce tension or tightness in the muscles. And then other people will need a little bit more strengthening, right? And sometimes that is a little bit more targeted towards truly contracting and strengthening the pelvic floor muscles in themselves. And other times, even on the relaxation side, is more so kind of hip and core, abdominal strengthening, breathing exercises, those sorts of things. So, a lot of people tend to think of this that comes up with women who are pregnant or after childbirth, but it can certainly be women after menopause. It can be younger women, that have had menstrual cycle issues or really painful periods and have different conditions like endometriosis, which can be very painful and affect multiple areas of their body and multiple functions. It can also affect men. Men have a pelvic floor too, just looks a little bit different anatomically. And so, they can have very similar complaints: urinary urgency and frequency, pelvic pain, constipation, again, very similar things. Sometimes it just come about from slightly different reasons. But it essentially can affect anybody at any point in their life.
Yeah, thank you very much. And you answered one of my questions, my next question, but you answered it. What is the range of ages that you um, see? Teenagers to
Sure.
postmenopausal?
Yeah, and there's even pediatric
Oh, really?
pelvic
Okay.
PT too. Our clinic does not treat that, but little kids with constipation issues or bedwetting, those types of things that can come about. Sometimes it's a little bit more neurologically driven as well. So there's a very wide variety within the specialty, if you will. So
Yeah. Well, thank you. I
yeah.
I forgot to ask you, where did you both grow up? Did you play sports? What drew you to um, physical therapy? Just so our audience out there gets to know you a little bit better.
I grew up in Kentucky,
Okay.
and I ended up then going, well, I guess will stay there. I grew up in Kentucky. I mostly played soccer growing up, but really, did the variety of things. And I have three siblings, so we were all very active, chasing each other around and doing all that sort of thing. So I've been very heavily invested in sports and athletics since I was a kid. Still very much have those interests. Then I went to undergraduate and PT school in Boston, which is where Pat and I actually met. But anyways, that's where I did my PT school, and I had at the time very little awareness slash none of the specialty of pelvic floor therapy. I thought I was going to stick along the what we call orthopedic route, and a little bit more focused towards sports. And then as I graduated and started my first job as an orthopedic physical therapist, working with kind of a general population, I took a continuing education course about pelvic floor therapy and really fell in love with it, and found that it really resonated with me as well. And so that's where I've taken my track professionally. I focus a little bit more on the pregnancy postpartum side of things, pelvic floor wise with my patients, but I do, again, see the wide variety as well. And I really love being able to combine both the pelvic floor and orthopedic side of it together so I can help people with their pelvic floor issues, but also where that affects them in the daily activities or sports or exercise or whatever that is they really love to do. So it's a very lovely opportunity to combine both of my passions together.
Great, great. Thank you. And Patrick?
I'm from Connecticut, and I went to Quinnipiac University, which is in Connecticut, for my undergrad and PT degree. And then worked in Boston, which Courtney said where we met. And from there, spent about 5 years working in Boston, and then spent about 5 years working in Santa Monica, California. I worked for the military for a year, like as a civilian PT. I worked outpatient, like general population, orthopedics, sports type stuff. So kind of like general stuff. And I tended to shift my treatments more towards spending more time with each individual patient, because what I was seeing was that each clinic I worked at, I would have less time with each patient. So patients would get less out of each session, even though they're going to end up paying the same amount per visit. So part of what made us do what we did, which is start our own business when we moved back to Connecticut, is that we wanted to work the way we wanted to work with our patients and not be limited by like time parameters.
Great, great. And the name of your practice is Regenerative Physical Therapy?
Regenerative Edge Physical Therapy. And
Got
wellness.
it. Nice touch there. Yeah.
Yeah.
Yeah. Okay. Both of you, can you see the questions that are posted in the chat room? Okay.
Yes.
So everybody, if you would like to ask a question of Courtney or Patrick, you can either raise your hand figuratively on the screen or type in your question, and then we'll just roll through these one by one. There was a few questions that were sent by email. I'll address that at the end, but Patrick or Courtney, if you wanted to just go one by one, read the question out loud, and then go ahead and answer it.
I can look at I guess the first one, Court, and you could add on the back end probably.
Yep.
So is KAATSU good for anterolisthesis L3, L4 to rebuild pelvic stability? So it's misspelled, but anterolisthesis is basically where you have a shifting of on the side, sorry, the L3 vertebrae forward on the L4 vertebrae. So it's a common thing you might see on MRI or X-ray. Some people have them and they're asymptomatic. Some people have them and they are symptomatic. So without going into too much detail of this person's individual case, I can't say for sure that what they should be doing with their medical care, obviously, but whatever they're doing already for pelvic stability, if you added KAATSU to that routine and you tolerated the KAATSU well, it would definitely help with your recovery as a locally, like on the pelvic floor itself, but also systemically with your circulation all over your body. And Court, if you want to add on more pelvic stability side.
Yeah, I mean, agreed. Obviously, there's, an individual case going on here, but to generalize it to most people, I would say as long as everything else is cleared and you're cleared to do KAATSU, I would say absolutely yes, it would be a great thing to add, especially if you're already doing some exercises that are focused on pelvic floor stability, or even just pelvic stability in itself, around the spine, around the hips, around the pelvis, adding that challenge of KAATSU training, I think certainly would help bring a greater benefit to the muscles and tissues healing. So I certainly don't see where it would hurt.
Yeah, I guess I should have been more clear. So explaining what it is, but we're talking about a lower back shifting of the vertebrae pretty far relative from the pelvic floor. So that doesn't mean it can't affect the pelvic floor. Obviously, your pelvic floor is like the base of your core, and the walls of your pelvic floor of their core are the abdominal muscles, the lower back muscles, your vertebrae, and the top of the core is your diaphragm. And that like barrel moves as a unit up and down, left and right. But if one area is weak or unstable or whatever word you want to use to describe it, that can affect the pelvic floor indirectly, and vice versa as well. Pelvic floor is unstable and someone has an L3, L4 shift there, that can exacerbate it because they're compensating for a pelvic floor issue somewhere else in their lower back.
Got it. And Courtney, and Patrick, I would assume you're using it on your legs when you're talking about all of these, the KAATSU bands on.
Generally, I would start someone with the arms, maybe for one cycle.
Mhm.
The first time I see them, at least, just to make sure they tolerate it well. And then, like for this particular case, you can get a lot of benefit from doing upper body stability work as well as lower body stability work. So doing upper body stability work in quadruped, on all fours, doing things where you're putting weight through your arms, so you can still get a lot of benefit from the pelvic floor and the diaphragm being more stable in those positions too. So it's not just strictly legs only for all pelvic floor issues, I would say.
Okay, great. All right. Did you want to take the next
Sure.
question?
Can BFR help the psoas muscle? So the psoas muscle is one of your hip flexor muscles. It's along with the iliacus, the other hip flexor muscle. It runs from the front of your lumbar spine to the front of your femur. If it's really tight, it can cause your lower back to have like a more lordosis or more of a curve, essentially. Not necessarily a bad thing to have lordosis at all. When you say rebuild it, I assume you must have pulled your hip flexor or strained it in some way. Unless you have like a nerve injury or something like that, which is not super common. KAATSU can help rebuild any muscle that, as long as you're able to tolerate exercise and loading it. KAATSU is going to be a fine addition to whatever routine you're going to do for any muscle group. So there's no reason why it wouldn't help your psoas muscle as well.
Yeah, and I would add to that, as Patrick was talking about the kind of barrel of the diaphragm, the pelvic floor, and then the abdominal and lower back and spine muscles, using it, let's say there's a lot of tightness or tension in the psoas muscle, I always feel like that hip in the front is very tight, or if you sit all day for work and those types of things, putting the KAATSU on more of like a recovery cycle mode and that sort of thing, and really working on some breathing exercises where you are moving that diaphragm, which has attachments, the psoas has attachments into the psoas muscle, right? Really working on some breathing exercises to restore that range of motion could also be very helpful. So, somewhat the opposite of strengthening in a different way that it could affect it too.
Thank you. And the next one?
Can you give an example of how you would use KAATSU with pelvic floor therapy? Sure. Actually, a lot of times right now we're using it a lot for chronic pelvic pain. And again, that could be pelvic pain that is generalized around the pelvis. That could be genital focused pain. That could be glute pain. It could be pain more towards the front. It could be sacroiliac pain. But in any case, chronic pelvic pain can be a very tricky thing to solve. And it can take a lot of time, and a lot of times it tends to really make our nervous system stay in like a fight or flight mode. And so kind of like I was just describing with using that to kind of relax that psoas muscle. You know, Patrick and I have actually been working with similar patients to use KAATSU in different ways to help their nervous system essentially relax and not have a lot of fire alarms going off, so that we can help those pain thresholds become more resilient, and overall people can get better pain management. So in any case, those exercises can be very much upper body focused if someone's having a harder time doing lower body exercises, and then that triggers a lot of their pain. Let's say someone is able to do things very simple like bridges or clamshell sort of exercises, or pelvic tilts, or on all fours doing like a bird dog or an opposite arm and leg reaching out type of stability exercise. You could certainly put either the arms or the legs bands on with that and work, again in more of like a lighter mode to work with overall movement and nervous system resetting. So that's one example of many. Hopefully that's helpful. Pat, I don't know if you have anything to add.
Yeah, so it's really hard to give like a specific exercise that I would recommend to someone without having talked to them first and knowing what their limitations are or what their issues are. but generally speaking, to start off with like the lowest level, you want to focus on like breathing. So we would give someone like diaphragmatic breathing in different positions. You could have someone lying on their side and doing breathing. And what that will do is allow them to focus on the rib cage that's not on the table or on the floor, focus on that half of the rib cage moving more than the rib cage that's blocked by the table. So you can create like artificial barriers to movement to emphasize like other areas of your torso to move or work a little bit. Um, like Courtney was saying, the main goal with most pelvic floor patients is to get them to down-regulate how much stress they're perceiving is happening to them. We don't need to, if Kegels were the answer to pelvic floor issues, then we wouldn't need to see patients because Kegels are easy to do and they a lot of times compound the pelvic floor issues that you see people have. Another one we do with breathing is like box breathing, for example. So if you don't know what that is, you can probably YouTube it. But basically, it's a certain amount of seconds, 4 seconds to start with. On inhale, you hold the inhale for 4 seconds, and then you exhale for 4 seconds, and then you hold the exhale for 4 seconds. And that's the box is basically 4 seconds of inhale, hold, exhale, hold. You could increase the time. You could do like 5 seconds, 6 seconds. And the focus there is to breathe through your nose to make the breathing like smooth, controlled. And that will be surprisingly hard for a lot of people to do well who have pelvic floor issues, who have breathing issues, who might not even realize they have it. If that exercise is really hard for you, then that's a good place to start.
All right. Very interesting. And then next one.
Yep.
So the next one is kind of similar to what we just answered, I think. But is there anything you want to add to that, Court? Or
Yeah, I mean, I guess if we want to talk about it a little bit more in the ways of strengthening, right? So essentially, even if I was going to do a strengthening protocol, we could call it with KAATSU, I would still have someone start with all of that diaphragmatic breathing work that really is, regardless if I'm using KAATSU or not for pelvic floor therapy, that is a very foundational place for us to make sure we're setting up and before we're working further. So anyways, having someone definitely work that background and that foundation. And then if you were to add some strengthening in from there, again, you could then maybe play with someone's tolerance to KAATSU. Maybe you do put it more on a constant mode to get a little bit more strengthening benefits. And that's where you could do, different sets of bridges as an exercise. You could do, a little bit more upright, like you could do deadlift sort of work. I love with a lot of my patients doing exercises like deadlifts where you really get into that like hinge position where the hips go backwards to really get a lot of lengthening through especially the backside of the pelvic floor. So that tends to be, any variation of a deadlift tends to be a really particular strengthening exercise that I'm working on for both the pelvic floor and the hips. Also squats can be a really great exercise, or step ups, especially, focusing more single leg there. So again, a lot of different ways that you can work on strengthening the pelvic floor. And, as we're talking about this, obviously we're not mentioning a whole lot with Kegels, right? Again, there's a very limited time and place where we will have our patients include Kegels with the rest of their therapy, but it's really challenging for me to recommend that on a general basis because not a lot of people fit into that category where they really need it. And as Patrick said before, it really can actually exacerbate some issues because even though they are easy to do, not everyone does them well. And sometimes there's really just not a need for it because it's actually too much on the system. So just putting that out there as well. So, let's say you're doing deadlifts as that strengthening exercise. A lot of times where I'll start incorporating that breathing in is doing, an inhale as you're going down and then an exhale, really working through the core on that exhale, creating nice tension and stability as you're coming up, especially if you're then adding load and weight to that. So hopefully that helps answer that question.
Got it.
yeah. So one specific example I would give, if you could try it if you'd like, it's an easy one to do, or it's easy to set up. It's hard to do, but you basically do a bridge, but you have your balls of your feet on a foam roller. So the foam roller is like horizontal.
Oh, wow.
And you have the roller a little farther out than you normally would for a bridge. And the goal is to press through the balls of the feet to do the bridge. So you're pushing from like the ground up basically to do the bridge. Instead of arching your back a lot, pushing through your back, you're supposed to basically create tension from your feet to your calves, your hamstrings, and then into your pelvic floor. Usually we'll start with make sure someone can tolerate that first. We don't just jump into that right away, but that's a harder exercise than like just the breathing we were talking about. But we initially start with breathing, make sure they understand how to breathe well, and then you do that exercise I just mentioned and make sure they're breathing the same way while they do the bridge as they did a second ago when they were doing something more gentle. And what you'll notice with someone who's having a hard time doing exercise or bracing the pelvic floor or doing whatever is that they'll hold their breath or their breathing becomes altered because they're having a hard time regulating the tension around their pelvic floor. So that's a really good one we like to do for anyone who has a weakness in like their backside, basically, which is a lot of people. So if you need, we at the end of this we could send like a YouTube video, some exercises to you guys, and you can go through a couple of them just to try it out.
Oh, that'd be great. When you were mentioning about breathing, I remembered way back when Dr. Sato, the KAATSU inventor, was first doing KAATSU on me, and I was probably like some of your patients. I was holding my breath. He would tell me to do something, and I was trying to impress him that I could do it. He ended up saying to me, he goes, "I want you to count out loud." And then I was forced to say 1, 2, 3, and it was forcing me to breathe. And so when you mentioned about breathing and sort of holding your breath, I know in my particular case, when I was in front of a doctor and he was asking me to do something, I wasn't thinking about what I was doing. I was thinking about what is his impression of my actions. And so I totally understand that.
It's
Yeah.
really common. See it all
Yeah.
the time. So
And then when you have these people do bridges, squats, all deadlifts, etc., how just roughly are they doing it like once 5 minutes worth, 10 reps about, but I know it depends on the
5
patient,
minutes of squats or deadlifts would be, these people would be destroyed. You'd have to be really well trained, especially with KAATSU. You have to be, that would be hurting. So for example, the bridges I mentioned before, I'll have someone hold that bridge position with the heels up as high as they can, pushing through the balls of their feet, and then hold that for 5 full inhales and exhales. So that could take, I don't know, 15 seconds, 20 seconds, depending on how fast you breathe.
Yeah.
And you could increase the hold time, or you could increase the difficulty by switching to single leg. So that's how I would progress that exercise.
Got it. Okay, thank you. And then next question from Kim.
Okay, let's see. How long would you suggest to begin PT with or without KAATSU with acute and compression fractures from L1 to L5 and all the way up to the thoracic spine from T12 to T5? So that sounds like someone has compression fractures from T5 down to L5, which is most of their mid back and all the way down to their lower back. So that's, again, a kind of complicated case, obviously. That's a lot of compression fractures, I would say, and that could be related to like a bone density issue. I don't know for sure. I don't know the person's case. I don't know anything about what's going on with them. But if you're worried about doing KAATSU, you have to make sure you get clearance from a medical professional, obviously, first. But you could do just passive, like KAATSU on your arms while you're watching TV or while you're doing something that you would do anyway without the KAATSU bands on. And that is a good way to get your arms, at least the tissues, a little acclimated to exercise and activity, and then see how you tolerate that for a day or two before you try doing any more progressions to like your legs or more harder cycles on your arms.
Yeah. Okay. And next one from Phyllis.
How effective has KAATSU been in pelvic floor muscle tone and strength? That's a very good question. It's very hard to measure. And again, it's a very, even being able to measure muscle tone and strength is very subjective from therapist to therapist. But in any case, I think it's overall a very helpful tool. If someone is able to use it enough, which, we're generally working with our patients 1 times a week, and that's, to see KAATSU be the only thing to show the difference is not necessarily going to be enough. So really, I would say if you're able to use it 3, 4 times a week at minimum, um, and use that along with some other structured pelvic floor exercises, everything that we've already talked about already, I think that's only going to be helpful in the grand scheme of things. So no, it's not a very exact answer, because it's very hard to measure and correct me if I'm wrong, but I don't know really of many research studies that show a lot of this anyways, because again, it's very difficult to answer and measure. But in any case, I do think that it certainly has an added benefit to going through pelvic floor muscle therapy and/or exercises, especially if you are in the zone of needing to do some strengthening around the pelvic floor. So I hope that was helpful, Patrick. I don't know what you have to add to that either.
Yeah. So what I would say is there's like the short-term effects of KAATSU while you're wearing them. You're going to get increased blood flow to the area. It's obvious when you're wearing it, you're doing exercise, that you're working harder in the area that you're using the muscles than you would be without the KAATSU bands on. Anyone who's used KAATSU and done exercise, you don't need a study to prove that the muscles acutely are working harder in the short term. I think the main benefit with the pelvic floor is the long-term effects of getting more capillaries into a tissue that already has a hard time getting blood in and out of it. For example, a lot of the patients that we see for pelvic floor therapy are diagnosed with recurring UTIs, urinary tract infections, and that happens generally because their pelvic floor is so tight, they're not allowing blood to get in and out of the pelvic floor, and then infections happen over and over again in the pelvic floor because they can't get things moving around the pelvic floor. So if you can get more capillaries into an area that has poor circulation, has poor function over weeks and months, you're going to see like a improvement in your quality of life. Like Courtney said, though, there's no real way to quantify like pelvic floor strength. Like if you feel strong doing something, then your pelvic floor is probably functioning well. If you feel really tight, really limited, really weak, then your pelvic floor might not be functioning well. But pelvic floor, when it's working well, is something you don't think about at all. When it's not functioning, it's the only thing you think about. But hope that answers your questions. I'm sorry, it's kind of hard to answer like with a clear cut answer for you.
Yeah, and
Yeah.
on top of that, I would say, to kind of the point of if you feel something in your pelvic floor when you're doing it, like if it doesn't feel strong, right? If you're noticing bladder leakage, if you're noticing pelvic pressure or heaviness, or like just like a feeling in females, if you're feeling like something sitting inside the vaginal wall, or if you are noticing any change in pain around the pelvis or the hips or the low back as you're doing a particular exercise, then chances are there's something going on that, needs to be addressed. And so if you're otherwise not feeling those things, there's likely to be said better functioning going on. Although, you never really know till you fully look at it.
Patrick, I think you said it best when you said if you don't notice it, you don't know it's there. But if you do notice something, it's all you think about. That's basically, we see that a lot with people who do KAATSU. One day they'll call us up or send us an email and say, hey, I don't feel my pain anymore. And we don't know when that switch goes from good to bad or from bad to good. So yeah, it's hard to tell. So um, you know, these are licensed, trained professionals, so they really like a very specific examples, and when they're trying to explain a comprehensive general description. So I think you're doing a great job there. The next one from Vera, I think you've answered it in various ways, but maybe you can give a few more examples of what you can do.
Asking, Ver is asking, oh, for the psoas. So for the psoas,
No. It's can you give an example of an exercise? I'm not quite sure what I
Yeah,
think.
go ahead.
They asked earlier about the psoas muscle.
I
I
got it.
think second question. So
Yeah.
so for the psoas, anything that brings your knee towards your chest is going to use your psoas. But you might have a tight psoas that's also weak. So you might need to stretch your psoas. So like a couch stretch. Again, it's easier to just show you videos or pictures instead of explaining it.
Yeah.
Like a lunge position.
Like a lunge position, but your back leg is elevated on like a chair or a couch. It's almost like the bottom of a Bulgarian split squat, but your knee's like on the ground. And that's a pretty intense stretch for the whole like front of your leg, basically. So from your hip flexor down to your toes. But a lot of things that bring your knee to your chest would strengthen your hip flexors. You could use a band, you could use a kettlebell, use a weight, you could use just gravity and do enough repetitions, and that will probably strengthen your hip flexors. So again, I would need to know where you're at before I give you a specific exercise and what to do for your specific hip flexors.
Got it. Okay. And then next question from Gary.
I know this is individual, but generally how long before or after an inguinal hernia surgery can you use KAATSU? Do you use on arms or legs? Yeah, so inguinal hernia is essentially where the lining of the tissues in kind of like the groin have separated a little bit, and then some of the kind of tissues behind it poke through it. So the surgery essentially repairs that hole, if you will, to keep things behind that layer of tissue. And oftentimes with a hernia, people can feel that bulging, or there can be a pain, groin or lower abdominal pain associated with it. So, um, you know, I would say in general, you could use it, again, get clearance from your doctor, but you should be able to use it within the first week. And like Patrick gave an example earlier, like wear it on your arms first, where you're just kind of doing your daily movements. You're sitting on the couch or you're brushing your teeth, or very, very gentle activities of daily living that you would typically be doing, not really exercise based at first. Start there, see where you tolerate it. As long as that's going well, then you could try the same things, but then move it to the legs. And then again, you'd want to get kind of the idea from your surgeon when to return to exercise or what other restrictions that you have. Generally in the like 4 to 6 week period here, for most people, you'll be able to go back to, light to moderate exercise and then progress from there. So, all the other exercises that we started talking about, especially the breathing component, that is where, I would definitely start with someone. So,
Yeah, I agree. You could do both arms as soon as you're able to do any exercise. You could do both arms just sitting there watching TV in the hospital bed for all I care, as long as the doctor is okay with you doing it. You could do just one leg on the KAATSU. If you plug the hole with the other hole with the little stopper, you can just train the one leg that hasn't had the inguinal surgery. And then the only thing I'd be worried about would be like any surgical scars being like rubbed by any KAATSU bands. I don't know exactly where your scars are on the inguinal surgery, but if it's pretty close to where the bands rub, you might just have to reposition the KAATSU band a little lower than you normally would. Steve may be able to talk more to positioning of the band.
Yeah, you're right. I mean, the last thing you want to do is, and maybe the sutures are taken out after X number of days, so you can always use it on the other leg. That's fine. That recalls I had there was a KAATSU user. He was in Japan traveling, just on vacation. He got in a car accident, a pretty bad one. He entered the hospital. They did surgery, and he sends me a email, and he said, "I have my KAATSU bands on here. I'm in a Japanese hospital. I can't speak Japanese. They can't speak English. Can you talk to the doctor so I can do KAATSU?" I said, I guarantee you he knows KAATSU. And sure enough, he started putting the KAATSU on, and the Japanese looked at him and said, "Hey, you're a foreigner." The Japanese doctors actually didn't know, those doctors in that hospital didn't know that KAATSU was actually used outside of Japan. So that was a little memory that I have. Yeah. And then we have one from Donna Down Under.
Let's see. I think this was from one of the emails.
Yes. Yes.
Did you want to take this one?
Yeah, I'm just trying to read through it for I'll read the whole thing here and do our best. Um I'm 62 and have 8 children, all quick and easy. Only 2 pushes on 3. So adding to that operation I had last Friday, which was left and right inguinal femoral hernia, and now 2 obturator muscle repairs. Not sure if they're on both sides, but feeling most on the right side. I see the surgeon tomorrow, but now that I'm up and walking around, I still feel the heaviness of the prolapse. I have had good bowel movements these past 3 days. Anyway, in research, I don't expect the op to address the prolapse as I thought. So when and how could I use KAATSU for the recovery and going forward with the prolapse? Um, My first thought here, so the inguinal and femoral hernia is different than what I would consider a pelvic organ prolapse. So I'm not sure if what this person's referring to in prolapse is something pelvic organ prolapse wise. Um, if that's kind of what you're referring to, that didn't get addressed as you would have been expecting. And for everyone else, a pelvic organ prolapse is essentially where the bladder and then the uterus and then the rectum, either one of those or a combination sometimes, essentially loses the integrity and kind of falls down into the vaginal wall. And that can happen in different degrees from like a grade 1 to a grade 4, where it's still sitting within everything within the pelvis. But then there are, into grade 3 and 4, that tissue can actually be exiting out of the vaginal opening. Um, so that's what pelvic organ prolapse is. Um, I'm just trying to go back to this question to make sure I answer it the right way. I don't says when and how could I use KAATSU for the recovery? So I think going back to what we've talked about already, with really starting with some of the breathing foundation, and really working a little bit more on restoring movement from the diaphragm and the kind of core and spinal muscles and the pelvic floor underneath. So, essentially you want to get nice good expansion of all of that 360 degrees around on the inhale. And then on the exhale, you can kind of create a little bit of tension through those layers and have things compress. And then you're just kind of working back and forth between that inhale and exhale. And then I would start probably with the arm bands here. My first thought really is I really would want this person to see, certainly follow up with the surgeon, which sounds like they are, but I would want them to see a pelvic floor therapist if possible. If there is a pelvic organ prolapse going on, it sounds a little bit more complicated here. But as far as like getting started, that's where I would go. Again, focusing on some of that breathing. Use the KAATSU on the arms first, then see how you tolerate with the legs. Essentially treating prolapse for the most part. We want to take as much pressure away from the bottom of the pelvis and the pelvic floor as much as possible. So a lot of that becomes being aware of posture. A lot of it becomes aware of breathing, definitely a lot of hip and core strengthening and stability, from one side to the other. What you mentioned here with the obturator muscle repairs, the obturator internus muscle actually works very closely with the pelvic floor. There's one on each side. So depending on kind of what the repair is going on there, that may impact how quickly you're able to get back into some exercise as well. So this is kind of a tricky one to answer. There's a lot going on here, and I'm not exactly sure the full story, but I would definitely, from a pelvic organ prolapse standpoint, really would want you to start with some foundational breathing, and then kind of get a jump on more so like hip and core stability and strengthening and focus there. and then put some postural habits in mind. Some different lifting mechanics, those types of things that you're doing, especially with all the kids around. Um, you know, being at 62, I would also want to be curious about what's going on from like a hormonal standpoint. Are you on any kind of hormone replacement therapy? How does that affect the integrity of the tissues underneath? So, and it's a long-winded answer, but hopefully that gives you something to work off of there.
Thank you. Thank you. And then
Yeah.
go ahead, Patrick.
I was just going to say, if it helps you guys, we have a pelvic floor health like questionnaire that goes through some of the issues people might have, and it gives someone an idea if it makes sense for them to actually make an appointment with a pelvic floor like provider, a physical therapist usually, but it could be someone else who does pelvic floor therapy as well. You can do virtual, you can do in person, but sometimes if you're not sure, it's better to talk to someone in person who can actually meet you where you're at and give you things that you can do like at that moment, instead of having it be like DIY. That's what I would say.
Yeah, okay. So what we'll do, Patrick and Courtney, if you could send that information, and we're gonna email everybody sort of a summary of what we've done, and that would be good information to add, including the videos that you've already prepared.
Yeah, perfect.
And last one from Phyllis.
Thank you. Any specific exercises to recommend for prolapse while using KAATSU? I think Courtney just answered that one kind of, right, Court?
Yeah, yeah.
Question for Steven, it looks like, after that.
Yeah. Yes. Okay. Next question. Was it your son who had a broken arm, then used KAATSU while his arm was in a cast? When was the cast removed for the new cast? His doctors were surprised at the muscle volume. Or is this just a story? No, it's actually a story of my 14-year-old son that was actually replicated more than one occasion, including with a Boston Red Sox professional baseball player. So what happened was my son in junior high school was messing around with his friends, and he broke his humerus up in his upper arm and his wrist. And they took him to the emergency room. They said it, and the orthopedic surgeon there, I asked him as a father, I said, can you put the cast a little bit lower on his arm so I can put some KAATSU bands on his arm? And the orthopedic surgeon said he didn't understand what I was saying. I said, oh, this was, he's 25. So this is 11, 12 years ago. And the surgeon said, I'm not understanding what you said. He goes, but what you're telling me about KAATSU seems like it would be logically helpful for him. I said, it is. He said, but I just want to call my mentor. He called the doctor, David Chow, who just so happened to be our chief medical officer of the company. I didn't know that his mentor was someone I had known and had been doing KAATSU for many years. And he calls up his mentor, this well-known orthopedic surgeon in San Diego, and he described very accurately what I had described to him. Make a long story short, the doctor said, yes, go ahead and do it. So they put the cast a little bit lower than they normally would so I could get a KAATSU band on his arm. And what he was doing was he was doing what we call single limb KAATSU. So he was only doing KAATSU on the arm that was broken. And he did it, the 14-year-old boy, he just wanted to go out and play with his friends, and he had this big cast on, and people are signing the cast, but he'd come home and we were doing KAATSU. About, I would say 3 weeks after he had the cast on, he was crying a lot. And he didn't cry when he broke his arm. He was crying 3 weeks afterwards. And we said, why? He goes, I want this cast off. We thought he wanted the cast off just to go play with his friends, play normally. What was happening was his arm actually got bigger, physically bigger, because as he was doing the KAATSU, it was a full cast. So I was just having him raise his arm, squeeze his hand, etc. And his 14-year-old boy has a lot of hormones going through his body. and he wasn't lifting weights or anything. He was just doing different movements with his arm that I was taught by the Japanese doctors. We took him to the hospital, and they looked and they said, "Oh, this is quite strange." They cut off his cast. My son was happy as can be. His arm was visually bigger than the other arm. And the doctors were just staring at him. They said, "What just happened?" I said, "Oh, well, that's the KAATSU effect." I mean, he had hair on his arm, and he's not a hairy guy, but he had hair on his arm. I mean, his arms were bigger. The doctor, actually very intelligent, looked at his fingernails, and his fingernails literally were longer on his KAATSU arm versus the other arm. Again, when you're a 14-year-old boy growing and you're only doing KAATSU on one arm, this happens. So dial forward, yes, his arm did get bigger. Unfortunately, my son was very sad when they actually put another cast on him. This one with a little more room, because we said we were going to continue KAATSU. So that was the story of my son back in, it was probably 2013 or 14. A year ago, a Boston Red Sox outfielder went to go catch a ball. He sort of dove for the ball, broke his wrist. He put his cast on. He was a young player, not a superstar yet, but he was pretty good, a starter. Same thing. Boston Red Sox do a lot of KAATSU, and we had our chief performance officer, someone Patrick and Courtney, Chris Morgan, up in Boston. He taught this player about KAATSU, and this young man, being on the Boston Red Sox was his lifelong dream, and he attacked KAATSU. I mean, he says that he was doing KAATSU 6 or 7 times a day. I think he was just literally doing KAATSU all day long on one arm. Same thing happened. They took off the cast, and it was his biceps were huge, his triceps were huge, his forearms were huge. I got a call from his orthopedic surgeon because he said, "Well, what? Like, I don't understand this." He goes, "It's KAATSU, it's KAATSU." And he says, "Well, so anyway, Chris Morgan and I were called. We were actually called to the Harvard Medical School because the Harvard Medical School doctor was a doctor there. And anyway, he same thing happened. So when you do single limb KAATSU, you're a young man, especially when you're a young man and you're doing something physical, working on one side, you will get bigger. Whether you're a 14-year-old boy or a professional baseball player.
Would you, if you could go back, would you have done it on both arms for your son?
No, I would continue to think, because he actually recovered very quickly. He broke the wrist at the growth plates, and it wasn't a compound fracture, but it's pretty bad fracture on the humerus. So we just wanted to. He's a water polo player, so he was dying to get back to play. So I would have done the same. I was less concerned about the imbalance that was caused, as opposed to just getting him back to play his sport. Now, if he were doing something else, water polo, he was a righty, so throwing the ball with his right was very important for him. So, but if you're a pianist, if you were someone who the left and right side were equally as important, I would have done it on both sides. But in his particular case, for the thing that he wanted to achieve, which was get out of the cast as quickly as possible, I'd still do the single limb KAATSU.
Makes sense.
Yeah, and then we have one more question from Kinga from Norway. Welcome, Norway.
Hi from Norway. I'm a first time in a quick way. I'm a kettlebell instructor, 5 years, SFT1, yoga coach, practice breathing, Buteyko method, and many other methods. I'm 49 years old. I used KAATSU 6 years ago when I lived in Poland. Now I have mine here 2 weeks. I have inflammation of the tendons in my hands. It doesn't want to pass. Do you have a good advice on how to use the KAATSU? The pain in my hands gets worse after using KAATSU leg bands. So I would need to know more about what kind of inflammation you're having in your hands. If it's getting worse after KAATSU, which means you're getting more blood flow to an area and it feels more painful, it might not be something simple that KAATSU can help with, at least right this second. Um, you should almost never have more pain after using KAATSU. Lactic acid pain, that kind of thing, is different than like finger, tendon, and joint pain. Most people can differentiate between the two, hopefully, but um, I would want to know more about how you're using the KAATSU. You could be using it on too intensive a setting. You could be maybe doing it on high instead of doing it on low, or maybe you're doing a constant setting instead of cycling. Um, I would maybe try one hand at a time or one arm at a time. And then maybe when you're doing exercises with the KAATSU band, maybe you're doing too intense exercise. So if you're doing like grip exercises, maybe you need to use less weight, less reps, maybe even something simple as just using like just opening, closing your hands with no actual weight or resistance is a good place to start. You could try doing it like in water if you need a little resistance, or doing it like in a rice bucket or sand bucket. That's a little more challenging than just doing it against no resistance. Maybe Steve would have more to add as far as this case.
Yeah. Usually what happens, I would say 95% of the time when there is some associated pain with KAATSU, it is because either the bands are placed too tightly. So I got a black shirt on, so that doesn't help, but so either you're putting on the bands too tightly, and we always recommend having a one finger tightness, so we can put one finger in. Now, if you are feeling pain, do two fingers, sometimes even three fingers. So you put the band on less tightly. Thirdly, what you can do is always start off in low pressure, always 100% of the time. That it will apply a lot less stress than a high pressure. And then always, as Patrick mentioned, use the cycle mode as opposed to the constant mode. And then very importantly, again, when you have associated pain, you might be doing something too intensely, too heavy, too vigorously. And so either slow it down. If you're using very lightweight, use no weight. If you're using moderate weight, use lightweight. And usually that takes care of the problem. Now, some of the questions we would ask is the pain equal on both left and right hand, and other questions. But generally, if you um, put the pressure a little bit less, put the band on a little less tightly, do something less vigorous, less intense with either no weight or very lightweight, it probably will take care of the issue. But very importantly, start off with a low pressure and always use the cut cycle mode. So you'll only have 30 seconds of pressure before the band is released. So that usually takes care of the associated pain that we see, whether it's a lower body or upper body with KAATSU. Yeah. There was one other question I forgot. I think it was also from Donna Down Under, and she was asking about the use of compression socks or compression sleeves. So compression socks on the legs or compression sleeves on the arms while using KAATSU. This is a related question. Some people say I use EMF. I'm sorry, EMF. What's the electronic magnetic EMS? Can I do these various things with KAATSU? We always recommend. I know you're trying to be efficient and save time, but if you're using compression socks or compression sleeves, just take them off, then do KAATSU. So do it without the compression sleeves or compression socks. Same thing with EMS or others. I know there have been studies and other things that have combined the two, but KAATSU works on the vascular system. It helps with the hormonal response. So just focus on that. You can do the other modalities either before or after. And so Donna Down Under, I would recommend take off the compression socks or sleeves when you're doing KAATSU. You can put them back on when you're finished. So I thank you very much. You guys are firing away with the answers to everybody's questions, and appreciate that very, very much. And thank you very much for your time. If anybody is in the Connecticut area, Patrick and Courtney are the people to see. And maybe if you do a little shout out for your there's a website or other things that people can check out if they're in the
You can find us
Connecticut
on
area.
Instagram. When we send the email out later, we'll put our
Okay.
Instagram and social media on there. And then I have appointments on the KAATSU website as well for sessions. If someone wants to get more creative or use on specific issues, we can happy to meet with you there.
Okay, great. Well, thank you again. I appreciate your time. And keep up the great work.
Thank you
Thank
so
you.
much.
Thank you, everybody, for joining. All right.
Thanks, guys.
Bye.